all kind of anterior in the dome. The thing that's tricky about her in resecting something this big is you can see on that CT scan, the tumor itself is probably T3. It looks like it's pretty much going all the way through the wall. The remainder of the wall, especially laterally, is really paper thin. And
Cancer Case Conference is a meeting that we have once a week that can also be called tumor board by some people, where a bunch of different disciplines, so radiation oncology, medical oncology, surgery, pathology, the radiologists, cancer navigators, a whole bunch of people from different disciplines come together, and we discuss each case individually, how they presented, what the imaging looks like, what the pathology looks like, and then discuss it as a group amongst all these different disciplines.
Anatomically, if there's any understand that might sort of help guide you besides.
In the reality of oncology, there's some art to this medicine, and hearing the insight from all my different colleagues in some of these cases that can be some more challenging, or if somebody doesn't fit perfectly into a box, provides a lot of insight into the patient's care. Not only that, but hearing the insight from folks in different subspecialties such as interventional radiology, radiation oncology, that can provide different insight into the patient's care and different treatment options is incredibly helpful as well.
We can correlate what we're seeing in pathology with what they are seeing when they're operating on the patient. For example, in radiology, we learn better how to look at MRIs and CT scans and the ultrasounds that they look at and how they look for cancer and the abnormalities they look for. It's great talking to the surgeons because we learn what was going on when they were operating on the patient, and the oncologists, of course, and the radiation oncologists. It's really nice to hear how they're going to treat the patients, their plan for the patients, because then we can alter our pathology reports to reflect things that they're looking for, such as different molecular testing that they need and want. We are able to send tissue out for those, the latest tests that they need.
There's a wealth of knowledge within one room. The Cancer Resource Center staff routinely attend the cancer conference every week, and that consists of both the navigators and our genetic counselor. Our presence and participation there help provide kind of the patient perspective after we've met with them, and also we can provide input on the role for genetics within the patient's cancer treatment and possible screening options for themselves and their family.
She was admitted with left upper chest pain.
A typical case, like a breast cancer case, would really start off with one medical provider. So it could be a medical oncologist, a radiation oncologist, or the surgeon, kind of giving a little bit of background on the patient, how old they are, what their health is like, and then giving the story of how they came to care, how they presented. And then once that general story is out there, we will often review all their imaging. So the radiologist will pull up their mammogram, MRI, maybe PET scan if there is one, and go through it with the whole group, and that way everyone can look at the image together. And then we will typically look at the pathology, so the pathologist will bring up the slides where the biopsy samples are, and they will go through what their findings were. And then afterward, we sort of can open it up to discussion. Usually there'll be some summative comments where we talk about, this is what I was thinking of doing, and other oncologists are able to bounce ideas off of that, or other radiation doctors are able to weigh in and talk about the role of radiation, or surgeons are able to weigh in and talk about the role of surgery in that situation, and come together to formulate a plan.
I really like this meeting because it allows us to get together and come up with a plan for an individual. Again, we're not in the business of taking care of a blob of cancer cells, but individuals who happen to have the diagnosis of cancer. Patient X, who has a diagnosis of stage 3 breast cancer with different social, economic, other issues, age and other comorbidities and other diseases that they have, might need a different treatment plan than patient Y with stage 3 breast cancer. So we really talk about the patient and every individualized need that they have. So coming together with all these folks to come up with an individualized plan with all these folks present has been very helpful.